Dr. Janice Russell here, and I want to share just a little personal tale and then globalize it just a little bit more because I know that some other people may be interested in this information. So recently, I had a little bit of a scare with my knee. I had some pain and I had had my left knee replaced in 2023. I'd had a revision for it in 2025. So having pain now in 2026, not a happy thing. And after some x-rays and yada yada, was looking at possibly having to have another surgery. No joy there. I happened to mention all of this to my primary care, and she suggested that we start with a vitamin D test. So it turns out that many insurances, at least in the US, do not cover vitamin D testing on your blood lab results, on your blood labs, as a standard measure. And if you do want to get it, you have to self-pay. Now I'm thinking, hey, if it will get me out of a surgery, I am more than happy to do that. She also suggested that I get a a bone density test. Now I am 61. It is usually recommended starting at age 65. However, in postmenopausal women, insurance will cover it. So she ordered one of those as well. But in the meantime, I started looking at, hey, I want to know a little bit more about osteoporosis because that could be part of the problem here. So as you probably already know, it is a skeletal disease that is characterized by low bone mass and deteriorating bone tissue, not something that anyone wants to have. And it does lead to increased fragility and fracture risk. Now, I won't go into all the other, stuff about that, but I will say that worldwide, the International Osteoporosis Foundation estimates that 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporotic, I'm sure I'm saying that wrong, fracture in their lifetime. So let me just let you know, in case you want to know sort of who's more at risk. Not surprisingly, women are disproportionately affected, which has to do with that decline in estrogen after menopause because that accelerates blood loss. Age itself is a universal factor because as our body ages, bone remodeling slows and calcium absorption decreases. Lifestyle factors, so things like smoking, excessive alcohol consumption, a sedentary lifestyle, a diet low in calcium and vitamin D, all increase the risk. I found out that my vitamin D was actually very low, so I am on vitamin D prescription for now, and we're going to retest in 3 months. Low body weight can also be a contributing factor. I have to say that for once, being overweight is in my favor because I am not at that risk factor of low body weight, not something that applies to me. There are also certain medical conditions and medications that can accelerate bone loss. So things like rheumatoid arthritis, celiac disease, inflammatory bowel disease, and certain cancer treatments can also be culprits. Osteoporosis, as you might guess, is the primary diagnostic tool is that bone mineral density. Happy to report that mine came back normal. So that's a good thing. Don't have to be tested for that again for 5 years. And it is very easy, very quick, no pain involved. It's a wonderful thing. Treatment itself, if you're diagnosed, is multifaceted, and it does typically involve that combination of lifestyle changes, nutritional support, and potentially medication. I already went over a little bit of, what some of the risk factors are. So some of those obviously turn into the lifestyle changes, exercise, eating more healthy, including calcium and vitamin D, all that kind of stuff. Another piece to it, though, is fall prevention. So making sure that in your home or in your office, you can navigate well, there's good enough lighting. If you happen to have vision or balance issues, that those kinds of things are addressed, just to sort of keep everything on the up and up. The other piece that I always like to explore when I'm looking at things is, are there any Eastern medicine approaches that can be helpful? And as usual, there are some, yes. So traditional Chinese medicine, which can include herbal medicine and acupuncture. There is some Ayurvedic medicine that uses specific herbs and supplements. Tai Chi and yoga are all helpful when it comes to osteoporosis. And as per usual, it is always good to make sure that that all of your medical professionals know what all's going on. The Eastern and Western medicines are, increasingly viewed as complementary rather than competing. But we do want to make sure that everybody sort of knows what's going on. I will tell you, of course, that this post is just provided for educational and informational purposes. It does not constitute me giving you any kind of medical advice, not intended for you to use as diagnostic or treatment of osteoporosis. You do need to always get the advice of a qualified medical professional. And I did get the resources for this from several different places, including Bone Health and Osteoporosis Foundation, the American Academy of Orthopedic Surgeons, and the International Osteoporosis Foundation and the Osteoporosis International. So just so you know, this did not come from my brain or from AI, I might add. If you would like more information, I actually have a whole blog post on this, and I will make sure that that link gets put into the comments so that you can access that. That link will also have the specific resources because I know I covered them really fast. So I hope that this was really helpful for you, and I urge you to subscribe to my YouTube channel so that you can see other videos as they come out. Thanks so much.